I think it's important to tell new people that A, it's not your body's fault. It's not your fault for what's happening to you. And B, to get as much support as you can, whether that takes the form of a support group in person, if there is one local to you, or online.
So if you don't face the reality of it, then you can't get past it. You have to be able to admit to yourself, did I really just go to the bathroom 10 times in the last 5 hours? And I have to talk about this. I have to get to that next place that says, how do I not have that happen? And where do I go from here?
My best advice is just share your story with someone else and let them encourage you to kind of find that courage from within and take that first step. For me, that was a bit of a mind shift to learn to be my own advocate and to really push for the best health care that I could get.
We're all unique, and we need to really get to know our body, because the doctor, he doesn't know your body. He's got all these opportunities to try different things, but he doesn't know your body in particular, so you have to help educate him. And you know, it's really critical to find a doctor that's willing to be a partner with you.
Focus on what you can control, and that is your medication, communication with your doctor.
Humor's been a really important, when I tell my story, I sometimes end it by saying that, laughter really is the best medicine. And it has been for me, and I'm grateful to be able to laugh at things now.
ENTYVIO is a prescription medicine used in adults with moderately to severely active ulcerative colitis or Crohn's disease when certain other medications have not worked well enough or cannot be tolerated. Important safety information about ENTYVIO, vedolizumab. Do not receive ENTYVIO if you have had an allergic reaction to ENTYVIO or any of its ingredients. ENTYVIO may cause serious side effects, including infusion-related and serious allergic reactions can happen while you are receiving ENTYVIO or several hours after treatment. You may need treatment if you have an allergic reaction. Tell your healthcare provider or get immediate medical help if you get any of these symptoms during or after an infusion of ENTYVIO: rash, itching, swelling of your lips, tongue, throat, or face, shortness of breath or trouble breathing, wheezing, dizziness, feeling hot, or palpitations. Feel like your heart is racing. ENTYVIO may increase your risk of getting a serious infection. Before receiving and during treatment with ENTYVIO, tell your healthcare provider if you think you have an infection or symptoms of an infection, such as fever, chills, muscle aches, cough, shortness of breath, runny nose, sore throat, red or painful skin or sores on your body, tiredness, or pain during urination. People with weakened immune systems can get progressive multifocal leukoencephalopathy, PML, a rare serious brain infection caused by a virus. Although unlikely while receiving ENTYVIO, a risk of PML cannot be ruled out. PML can result in death or severe disability. There is no known treatment, prevention, or cure for PML. Tell your healthcare provider right away if you have any of the following symptoms: confusion or problems thinking, loss of balance, change in the way you walk or talk, decreased strength or weakness on one side of the body, blurred vision, or loss of vision. Liver problems can happen in people who receive ENTYVIO. Tell your healthcare provider right away if you have any of the following symptoms: tiredness, loss of appetite, pain on the right side of your abdomen, dark urine or yellowing of the skin and eyes, jaundice. The most common side effects of ENTYVIO include common cold, headache, joint pain, nausea, fever, infections of the nose and throat, tiredness, cough, bronchitis, flu, back pain, rash, itching, sinus infection, throat pain, and pain in extremities. These are not all the possible side effects of ENTYVIO. Call your healthcare provider for medical advice about side effects. Before receiving ENTYVIO, tell your healthcare provider about all of your medical conditions, including if you have or think you may have an infection, or have infections that keep coming back, have liver problems, have tuberculosis, TB, or have been in close contact with someone with TB, have recently received or are scheduled to receive a vaccine, or if you are pregnant, breastfeeding, plan to become pregnant, or plan to breastfeed. Please see accompanying full prescribing information, including the medication guide for ENTYVIO, and talk with your healthcare provider. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Uses of ENTYVIO, vedolizumab. ENTYVIO is a prescription medicine used in adults for the treatment of moderately to severely active ulcerative colitis, moderately to severely active Crohn's disease,